So just a little history to our case. It's a 49-year-old male. He was referred to outpatient physical therapy 7 weeks after surgery. The patient received a non-cemented knee prosthesis. He has recently advanced to weight bearing as tolerated. The patient's range of motion in the involved knee is 10 to 85 degrees. The patient otherwise is independent with axillary crushes, and no significant past medical history is noted.
Hi.
Hi, Lee. My name is Bree. I'm a student physical therapist assistant at Baker College. Is it okay if I work with you today?
Yeah, of course.
Okay. So I see that you have had a knee replacement 7 weeks ago. How is your pain today?
It's not too bad.
Okay, on a scale of 0 to 10, 0 being no pain and 10 the worst pain, what would you rate it at just sitting here?
Maybe just like a 1 or 2.
Okay, and then how about with movement, or when is it at its worst?
It's at its worst when I try to go farther than it lets me go.
Okay.
But it's not super bad. I haven't been doing a lot.
Okay.
They just told me I could walk on it.
What would you rate it when it's at its worst on that 0 to 1 or 0 to 10
It
scale?
only just gets up to a 3 or 4.
Okay, good to know. I'm going to take your vitals right now. It's just policy for our clinic.
Okay.
So I'm going to put your hand through here. Good, that was a 118 out of 80. What, do you know what your normal blood pressure is?
No, it's 120 over 80. So.
Okay, so sounds about good for you.
Yep.
Then I'm going to take your pulse also, so just, you can go ahead and relax your arm right here.
Okay.
Good, you're at about 58. Okay, now I'm inspecting the knee. Your incision is looking really nice. Is it giving you any problems?
No, not
Okay, the swelling is looking pretty good. Have you been having any issues at home?
No, not really.
Oh,
I've
so
just been using my crutches.
Okay, so have you used just regular walking at all, or always using your crutches?
Always using my crutches or hopping on one foot.
Okay, so I think our goal is to get you off of those crutches as soon as possible, so you don't have to worry about those so much anymore. Is there any activities you're trying to get back to? Or?
Yeah, I would really like to not have to use these because me and my wife go hiking a lot and we haven't been able to do that.
Okay,
So I'd really like to get back to that.
sounds good. So we're gonna assess your range of motion now. So I'm gonna start with having you kick this leg out as far as you can. Good, that looks about right. Functional. And then go ahead and bend your leg as far as you can. Good. So I'm seeing that her right leg is within functional limits, and now I want to test the left leg. So I want you to again kick this leg out as far as you can. Good, and then I'm going to measure. So I have the axis on the lateral epicondyle, the stationary arm parallel to the femur, and the movable arm parallel with the fibula. And can you get any more? Strain as much as you can. Good. So I'm getting 7 degrees from extension there, and then if I go ahead and push you a little bit further, how are you doing?
Good.
Okay. Then we get to about 5 degrees from extension. Now I'm going to do flexion, so I want you to bend your leg as far as you can. Good. Keep going as far as you can. Can you go any more? Good. So we're at about 80 degrees. And then if I push you a little bit further, we're looking at about 84 degrees. So now we're going to measure muscle length. So I want you to grab this leg behind your knee like this. Yep. And then go ahead and lean back onto the table. Good. We're measuring the rectus femoris right now for tightness. So are you able to bend your leg any more than this amount?
No.
degrees of flexion. So because she had less than 80 degrees of flexion, that tells us that she has a tight rectus femoris. So now I want you to go ahead and scooch back on the table until you're comfortable. That's probably good right there. You can go ahead and lay this leg flat. Good. Actually, you're gonna have to move back a little bit more. Thanks. Okay, now go ahead and lay flat. Now I want you to bring this leg up. Good to here, and then hold. And then we're gonna extend your leg as far as you can. So is that about it? Okay. So again, we're measuring, same axis. You're gonna feel some stretching. Do you feel a stretch?
Mm-hmm.
Okay. Is that about as far as you can get?
Mm-hmm.
Okay. So we're about 45 degrees from extension. So 20 degrees from extension is within normal limits and would show no tightness, but because she's at 45 degrees from extension, she is tight in her hamstrings. Okay, so now we're gonna test the strength of your muscles. So this is your unaffected side. Go ahead and kick your leg all the way forward and bring it all the way back. So I'm looking at her full functional range of motion and then going about mid-range between that. So let's go to about here. Good, I don't want you to let me move you from this position, okay? Ready? Hold, 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 good. And then other way. Hold, 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 good. So I'd give her a 5 out of 5 for that. If we switch to the other leg, I want you to move that towel onto this side. Perfect. So same thing, go ahead and kick this leg forward as far as you can, good, and then back. Good, and then we'll go to mid-range of that. So same deal, ready? Hold, hold, hold. Okay, so I broke her there. That would be about 4 out of 5, and then same thing, ready? Hold, hold, hold. Okay, another 4 out of 5. Okay, so now I want to get you up into standing, and we're going to see how your knee does with some weight bearing. Does that sound good to you?
Sure.
Okay, so I want you to slide towards the edge of the bed because you're pretty high up. Good. Get that first foot down. Good. Go ahead and stand up. Nice. How you feeling?
Good.
Okay, cool. So we're going to do some weight shifts like this. Go back and forth just to test out that leg and see how it feels. Good. Are you feeling okay?
Yeah.
Any
Feels
increased
weird.
pain? Feels weird?
Yeah.
Just different?
Yeah,
Not
just
used to
different.
it? Okay. Is it increasing your pain at all?
No.
No? So you're feeling okay. Cool. Do you want to go ahead and take one step forward? Nice. Good. Okay, let's walk over to this chair. Just let me know if you're feeling any increased pain. Still doing good?
Mm-hmm.
Okay. Go ahead and turn around. And then sit in the chair. Good. Good job sitting and then lowering. So let's have you go ahead and stand back up. You okay with that?
Yeah.
Okay. Is that knee still doing good?
Yeah.
Good. Okay, so I'm looking at your range of motion of your hip and your ankle while I'm doing this, just to make sure those are within functional limits and they're looking good. So go ahead and sit back down. Very good. Okay, so at home, I want you to work on, we need to increase that range of motion so it'll be easier to walk. You need full extension of your leg to have a normal walking pattern. So at home, if you're just sitting watching TV or whatever, you can kick your leg up onto a chair or stool, whatever you have. Good. And then just let gravity push down and extend that leg. You can hold it for 10 minutes or as long as you can tolerate. I want you to do that as often as you can. Does that sound good?
Yeah, I can.
Okay. The other thing I want you to do is go ahead and let it back down. Also, while you're sitting, super easy, go ahead and kick this leg over the other one. Bring this one as far back as you can. Good. Do you feel a stretch?
Yeah.
A slight pull? Okay. I don't want it to increase the pain, but a good pull is okay.
Okay, I can feel it stretching.
Okay, good. So, again, just hold this as long as you can, at least, we'll say at least 40 seconds, and then you can go ahead and relax, and we'll do that 3 times throughout the day.
Okay.
Does that sound good?
Yep.